Okay, so let's get this show on the road. We are ready to go. It is a minute past time, and we want to be punctual and make sure we get all the information that we're here to get today. So, good afternoon, everyone. I am Chris Riggs. I am the acting executive director of the New Jersey Cannabis Regulatory Commission. And on behalf of the CRC, I want to welcome you all to this important public hearing on the social equity excise fee. We are here today to hear directly from New Jersey residents, from stakeholders, and others about how these funds that are generated from adult use cannabis sales can best be used to support social equity initiatives, repair harms from past prohibition, and strengthen our communities through investments in economic development, workforce programs, criminal justice reinvestment, public health, and more. Your input today will directly shape our recommendations that we send to the governor and legislature. And I do want to highlight that the CRC is charged with making these recommendations directly to the legislature and the governor. We do not directly disperse these funds, but we do make these recommendations, and the information that you provide to us is very important for us to make those recommendations. So thank you for joining us today, and thank you for helping us build a more equitable New Jersey. With that, I'm going to introduce Commissioner Amelia Mapp, who is going to run through some slides on these social equity initiatives and some of the things that we are required to do. She's going to take it from here. And then we look forward to hearing everything that you have to tell us today and look forward to working with you in the future to make these things come to light. Thank you, Commissioner Mapp. The floor is yours.
Well, good afternoon, everyone, and thank you, Director Riggs, for your introduction. I am Commissioner Amelia Mapp, and I want to thank all of you for joining us today for the very first of 3 Public Engagement and Education Committee scheduled hearings for 2026. At this point, I must say I need to take a minute and present, as I present today, I must acknowledge Governor Phil Murphy for giving me the opportunity to serve on this board, since this is the last CEF meeting to be held under his administration. So again, thank you, Governor Murphy. As I continue, there are 2 additional hearings which are scheduled for Wednesday, January 21st at 1:30 p.m. and the other on Thursday, January 29th at 2 p.m. The Public Engagement and Education Committee is statutorily required to hold at least 3 meetings per year in order to solicit input from the public regarding the use of social equity fees. The goal of the committee is to give a brief overview of CEF, listen to your ideas, gather your suggestions, and provide you with the process for which your valuable ideas and suggestions are communicated to the governor and the legislature. The Cannabis Regulatory Enforcement Assistance and Marketplace Modernization Act mandates the legal and regulatory framework for the recreational cannabis in the state of New Jersey. The CREAM Fund is a special fund where all tax revenues, fees, and penalties from regulated adult use cannabis is deposited. The CREAM Act also established a fund which specifies where the money is collected from tax revenue, fees, penalties, and other sources, and provides provisions that separate revenue derived from the social equity fees. These fees are to be appropriated annually, and it is suggested that at least 70% of the tax revenue goes towards investment in impact zones, assisting with loans, grants, regulatory and administrative costs, municipal reimbursement for drug recognition expert training, and financial assistance to residents in these impact zones. The social equity excise fee, which remains at $2.50 per ounce, is a fee imposed on every licensed cultivator of adult use cannabis, which is sold or transferred to other cannabis businesses. The fee is not applied to medical cannabis cultivation. The use of SEEF funds is currently, as required by law, these funds are to be used for social equity initiatives, which will benefit communities that were disproportionately affected by the war on drugs and the individuals who live in them. Some of the past program recommendations are listed here, and they are apprenticeships, job skills and readiness training, food assistance, reentry and rehab services, expungement clinics, and financial literacy programs. Some potential investments and possible services for health and wellness suggestions were grants and loans, financial assistance, economic development, youth recreation, substance use disorders, and mentoring. These are only a few of the ways that SEEF funds can be used to improve the communities, thereby improving the lives of their residents. Now, this is where you and your valuable input is absolutely necessary. We want to hear from you. We want you to share your ideas and suggestions. Today, your role is to have a conversation. The conversation is about you. We are here to listen to you and document your ideas and your suggestions. Our role is to provide you with the forum to have your voices heard. And we do that by holding a minimum of 3 of these listening sessions per year as mandated by the CREAM Act. We will use these hearings to gather your recommendations and create the report to be submitted to the governor and the legislature. The social equity fee for 2025 was the same as it is today, which is $2.50 per ounce of usable cannabis. And the funds raised, we do not have a definite number on the funds raised as of right now. We're still working on finalizing those numbers. 1 second, please. Something just went off my screen. This is a snapshot of unconfirmed totals for cannabis sales for 2025. The amounts may vary upon confirmation, but that should only be a very small percentage. The recreational sales were approximately $1.1 billion in tax revenue. The revenue sales were approximately $68 million, and the SEEF amount was approximately $10 million. This shows a growth of the market and the direction that the cannabis industry in New Jersey is going. Now, this is where you come in. This is where your valuable input is absolutely necessary. We want to hear from you. We want you to share your thoughts and ideas and suggestions regarding the use of SEEF funds. Kindly begin by providing your name and organization, your municipality, and your county of residence, and definitely your ideas. You will have 3 minutes to speak, and you can also submit your ideas electronically if additional time is required. We ask that all comments be submitted electronically, whether or not you have had the opportunity to speak. As a reminder, your comments can be submitted via the link njcrcgov.info/Seith. I now turn the program over to Dara to assist in your presentation. Thank you, Dara.
Thank you, Commissioner. Thank you. As we open the floor to public comments, we also encourage you again to submit written public comments, and the deadline to do so is Friday, January 30th at 5 p.m. Written comments will be shared with the Commission members and will become part of the public record. Speakers are limited to 3 minutes. I will call on you. If you are calling in by phone, please press *9 to raise your hand. And when you hear your name called, please press *6 to unmute yourself. To make sure the meeting minutes are accurately reflected, again, please at least state your name before delivering your comments. I will give you a warning when you have 30 seconds remaining. I'm going to call on the list of speakers. Rick Robinson, can you please raise your hand? Rick Robinson. If you're calling in by phone, you can press *9 to raise your hand. Okay, I will move on. Walter Burton. Walter Burton. Okay. Misty Schworn. Misty Schworn. Moving on to Ihab Abu Hassan. If you are in the room, please press *9 to raise your hand. Ihab Abu Hassan. Okay. Robin Whitfield. Robin Whitfield. Okay, moving on to Brendan Robinson. Brendan Robinson. Mackenzie Stratton. Mackenzie Stratton. Moving on to Dr. Lisa Harrison Gullah. If you're in the room, please press *9 to raise your hand. I see you. Okay. Asked to unmute you. You can press *6 to unmute yourself.
Oh, I am on Zoom, so I should be good.
Very good.
All right. Great. Well, thank you so much. My name is Dr. Lisa Harrison Gullah. I live in Hillsborough, Somerset County, New Jersey. However, I am a licensed health officer and registered environmental health specialist, now retired from governmental public health, but currently active as an adjunct professor and as a former president of both the New Jersey Association of County and City Health Officials and the New Jersey Public Health Association. I've spent more than 3 decades working across New Jersey's public health system in practice, policy, research, and education. I really appreciate the opportunity to provide public comment on the allocation of funds generated through the social equity excise fee. And I want to speak directly to how Seith investments can and should strengthen the public health infrastructure that serves the very communities this fee was designed to support. Local public health departments are on the front lines of education, prevention, and community engagement efforts associated with cannabis legalization, including health education, youth engagement, substance use surveillance, environmental health protections, community outreach, and emergency preparedness. However, many of these departments are carrying out these responsibilities after decades of structural underfunding, limiting their capacity to sustain equity-focused initiatives without dedicated long-term investment. When I began my career, New Jersey's local health departments were supported by stable, dedicated funding under the Public Health Priority Funding Act. That funding eroded over time and was eliminated entirely in 2011. Since then, public health professionals have been asked to absorb new responsibilities, often tied to health equity, behavioral health, and substance use prevention without a corresponding reinvestment in people or infrastructure. Public health professionals are often asked to implement equity-focused programs in communities facing the greatest health and economic challenges, yet they're doing so with limited staffing and infrastructure. This disconnect places an unsustained burden on the workforce and undermines the ability of well-intended policies to achieve lasting impact. The social equity excise fee presents a rare opportunity to break this cycle. CEF funds should be invested not only in programs, but in the capacity to sustain them. Equity is not achieved through short-term pilot projects alone. It is achieved when communities have consistent, trusted, and adequately staffed public health systems capable of meeting residents where they are. I urge the Commission to recommend CEF allocations that prioritize sustainable investments in local public health capacity, particularly in municipalities and counties that have borne the greatest harms of criminalization, disinvestment, and health inequities. In closing, I respectfully ask the Commission to treat sustainable public health funding not as an expense, but as an ethical imperative, one that honors the workforce who showed up every day when the world shut down. By investing in long-term capacity, New Jersey can move from reaction to resilience, ensure that doing more with less becomes doing better with enough, and build the sustainable public health system its people and its professionals deserve. Thank you for the opportunity to comment and for your leadership in shaping a more equitable and healthier New Jersey.
Thank you. Moving on to Paul David Roman. If you're in the room, please raise your hand. You can press *9. Paul David Roman. Okay. You can press *6 to unmute yourself. Do you want to test your mic? You should be able to speak. Are you able to press *6? We are unable to hear you, Paul. I'm going to move on for now. We'll come back. Linda Bush. Linda Bush. If you're in the room, please press *9 or raise your hand. Moving on to AJ Jackson. Okay, I see you. Okay, you should be able to speak. Yes.
Okay, great. To the chair and to the members of the commission, thank you for the opportunity to submit public comment regarding the social equity excess fee and its use for community reinvestment. My name is AJ Jackson. I am from Essex County, New Jersey, and the founder of Oasis Productions LLC. And I'm writing in strong support of allocating a portion of the social equity excess fee towards strengthening local arts councils and the broader community-based art infrastructure in New Jersey's impact zones and municipalities. New Jersey has made a clear commitment to equity. not only in cannabis licensing, but reinvesting revenue back into the communities most harmed by prohibition. Yet many impact zones still lack the cultural infrastructure that allows residents to access opportunity, creativity, and economic mobility. Arts access is not a luxury. It is a proven driver of youth development, community health, and local economic growth. To address this gap, I'm proposing a 3-year, $2.5 million pilot program to establish or strengthen local arts councils in 3 impact zone municipalities. These councils would be community rooted, locally staffed, and accountable to residents. They would deliver programming for youth and seniors, support local artists, activate public spaces, and build partnerships with schools, libraries, and and small businesses. This proposal is advanced in partnership with Art Pride New Jersey and arts leaders across the state, all of us working together toward a shared vision for local arts councils and community-based reinvestment. The $2.5 million allocation is intentionally designed for a focused 3-year pilot in 3 impact zone municipalities. It fully funds local arts councils, community programming, and statewide evaluation. The goal is to demonstrate measurable impact and build a case for statewide expansion. This pilot is intentionally scoped and fiscally responsible.
Oh.
At approximately $833,000 per year, it provides stable funding for 3 municipalities while also supporting statewide coordination and evaluation. It is designed to generate measurable outcomes, participation, partnerships, economic activity, and community impact, and to provide the legislature with the data needed to scale this model statewide. Impact zones deserve more than temporary programs. They deserve permanent cultural infrastructure, places where young people can see themselves as creators, where seniors can stay connected, where artists can work and be paid fairly, and where communities can gather, heal, and grow. This pilot is not just an arts initiative, it's an equity initiative, an economic development initiative, and a community reinvestment strategy that aligns directly with the purpose of the Social Equity SSF. New Jersey has the opportunity to lead the nation in demonstrating how cannabis revenue can be strengthened, how cannabis revenue can be strengthened, how can strengthen communities in a tangible, measurable, and culturally meaningful way. I respectfully urge the Commission to support this pilot and help build a model that can expand across the state. Thank you for your time and for your commitment to equity, community reinvestment, and the future of New Jersey's creative economy. Thank you.
Thank you. We're going to move on to Daria Crooms. If you're in the room, please raise your hand.
Hello.
Hi, yes.
Ma'am, this is Paul Roman. Can you hear me?
Yes, I can.
I'm so sorry. I've been having trouble, but can I speak now?
Sure.
Okay. Good grief. My name is Paul David Roman, a 48-year public health volunteer leader and 57 years as an EMT educator and a military veteran. I'm president of the New Jersey Local Boards of Health Association, representing over 3,200 appointed or elected Board of Health members in New Jersey's 450 local boards. I'm also representing the members of the Public Health Association's collaborative effort, FACE, which is the coalition of all New Jersey's 6 public health associations. I'm also vice chair of the governor's appointed State Public Health Council. Our professionals are the boots on the ground responsible every day for the local delivery of public health services. It has been widely documented that New Jersey public health is woefully underfunded. Based on pre-pandemic national standards, New Jersey public health was staffed at 1/3 of the required level to perform all minimum standards and be prepared for the next public health crisis. Although currently benefiting from the final year of the targeted federal COVID funds, this money is going to dry up and is starting to dry up. Personnel and programs supported by these grants are being terminated, and we're going to be back to the 2019 dollars derived from local taxation and barely kept the doors open, with the practice standards being barely met. The new cost assessment study shows that $8.6 million is the shortfall to fund public health in New Jersey properly and bring us up to national standards. Nationally, $4.3 trillion have been spent on health care, but only $4.4 billion spent on public health, little of it going to the states. Gosh. As Dr. Gullis said a few minutes ago, C funds should be invested not only in programs, but in the capacity to sustain them. Equity is not achieved through short-term pilot projects alone. It's achieved when communities have consistent, trusted, and adequate staffing, for public health departments capable of meeting the residents where they are. The New Jersey Cannabis Regulatory Commission has requested our input for your report to the legislature on the best way to dedicate the new social equity excise fee raised from recreational cannabis sales, so as to get the most impact from social equity investments, especially in designated impact areas. I am proud to note that for the past 6 years in my annual testimony to the legislative budget committees, the idea of providing an excise tax on surcharge on smoking, vaping, and cannabis sales was number one on my list, possibly for new revenue streams to support and rebuild our 104 health departments. Obviously, somebody listened. In your impact areas, there are over 44 local health departments that represent many multiple municipalities and a total of 2.5 million in population. So we ask that by getting this money to us, I ask that you consider the apportionment of a significant amount of CEF dollars be dedicated to helping support public health departments with long-term capacity building funds in order to sustain the work already being done on your behalf. I will be submitting written testimony. Thank you.
Thank you. Okay, Daria, I see you here. Go ahead, Daria.
Thank you. Good afternoon, commissioners, and thank you for the opportunity to speak today. My name is Daria Crooms. I am from Essex County, specifically East Orange, that's a municipality. And I'm the owner and principal consultant of Capstone LLC, as well as a co-founder of the Cannabis Innovation Lab. I work at the intersection of cannabis regulation, municipal readiness, and economic development across New Jersey. I'm here today to speak specifically about the social equity excise fee and how its impact will ultimately depend not on how much is collected, but on how strategically it is deployed. In my work, I consistently see that New Jersey's equity challenge is not access to licenses alone, it is execution at the municipal and operational level. Municipal capacity gaps, compliance, complexity, and high fixed costs are quietly undermining equity outcomes. And when municipalities lack staffing or systems, and when licensees lack operational support, equity stalls, even when the intent is strong. To that end, I've submitted a short written executive brief outlining 6 implementation-focused ways CEF funds could be used to strengthen outcomes without expanding regulatory burden. At a high level, these include municipal capacity and readiness grants so towns can administer cannabis consistently and confidently, direct technical assistance for social equity licensees focused on compliance and operational sustainability, shared infrastructure and cost reduction programs and impact zones to reduce business failure, and transparent reporting mechanisms so the public and legislature can clearly see the outcomes of the CEF investment. These recommendations are designed to support, not complicate, the Commission's mission by reducing implementation risk, improving compliance outcomes, and strengthening public trust in the equity framework. As the owner of Capstone LLC, my role is not regulatory. I focus on helping states and municipalities translate policy into durable, compliant execution, subject always to appropriate procurement processes. I appreciate the Commission's leadership on this issue, and I look forward to continuing this conversation through a formal proposal following today's hearing. Thank you for your time and service to the state.
Thank you. And moving on to Aaron Gore. Aaron Gore, if you're here, please press *9 or unmute yourself. Okay, Jenna Russo, please raise your hand. Okay.
Can you hear me?
Yes.
Okay, perfect. Good afternoon. My name is Jenna Russo. I'm the Executive Director of the New Jersey Cannabis Business Association. I wanted to thank you for the opportunity to talk to you today on behalf of our members and the broader cannabis industry in New Jersey. Our position is keeping the CEF tax low. The New Jersey cannabis industry is still in its growth phase. We're building a market, we're establishing legitimate operators, and proving that regulated cannabis can be a responsible tax-generating industry. At this critical juncture, we urge the Cannabis Regulatory Commission to keep the CEIF tax at the current $2.50 per ounce rate. Excessive taxation would now directly harm the small, minority-owned, and women-owned businesses that were promised opportunity in this market. These operators are already navigating complex regulations, licensing restrictions that would have limited their access to equity capital, and competitive pressures. A tax increase would threaten their viability and undermine the restorative justice goals that were committed to when this market launched. Rather than raising the tax rate, we recommend that CEIF revenues be strategically reinvested into the cannabis industry itself, specifically into the current operators who are bearing the tax burden. This approach serves two critical purposes: direct grants for business expansion, provide grants, not loans, to small minority-owned and women-owned operational cannabis businesses to support expansion, equipment upgrades, and facility improvements. These grants should have minimal restrictions and allow operators to move forward quickly without burdensome compliance requirements. Work development and job training. Invest in an apprenticeship program and workforce development initiatives, such as those being offered by the UFCW and Rowan University, that create career pathways and stability throughout the supply chain. And this approach will work because when current operators succeed and grow, they generate more tax revenue organically. This creates a sustainable cycle. Reinvestment drives operator success, which increases tax revenue without requiring a tax increase. This approach stabilizes the entire supply chain from cultivation, manufacturing, retail, and protects the small operators who are the backbone of this initiative. We also want to emphasize that the CEIF tax burden begins at cultivation and flows through manufacturers and retailers and ultimately to the consumers. We must ensure that cultivation operators who are currently underrepresented and bearing a significant tax load are supported and stabilized. Without adequate cultivation capacity, the entire market suffers. We respectfully ask the CRC to maintain the CEIF excise tax at the current $2.50 per ounce through 2027. Unspent CEIF revenues be allocated to grants for current cannabis operators, prioritize workforce development and job training initiatives, support the full supply chain, including cultivation operators. The cannabis industry in New Jersey has tremendous potential. We can grow this market responsibly while supporting the small businesses and communities we promise to serve, but only if we minimize unnecessary taxation and maximize reinvestment into small operators. Thank you so much for your time.
Thank you. Moving on to Lynette Medeiros. If you're here, okay. You can unmute yourself or press *6.
Hi, can you hear me?
Yes, I can.
Perfect. Good afternoon, Chairwoman, Commissioners, and members of the New Jersey Cannabis Regulatory Commission. My name is Lynette Medeiros, and I serve as the Advocacy Chair for the New Jersey Association of City and County Health Officials and as the past president of the New Jersey Environmental Health Association. Together, these organizations represent the local public and environmental health professionals who work every day, often behind the scenes, to protect the health, safety, and well-being of New Jersey residents in every community. I appreciate the Commission's commitment to gather community input on the allocation of revenues generated through the social equity excise fee. Today, I respectfully urge the Commission to recommend that a meaningful and sustained portion of the CEIF revenues be designated to support New Jersey local public health infrastructure. Local health departments are facing an unprecedented convergence of challenges. While continuing to recover from the long-term impacts of COVID-19 pandemic, they are also responding daily to opioid overdoses, emerging communicable diseases, youth vaping and cannabis use, environmental contamination, housing instability, food insecurity, chronic disease, vector control, and climate-driven emergencies, along with growing mental and social health needs. These challenges are not theoretical. They are present in every municipality and affect the same communities the social equity excise fee was designed to support. One of those impact zones is the community in which both I live and work. At the same time, New Jersey families are experiencing record inflation, rising housing costs, and increased healthcare expenses. These economic pressures translate directly into public health needs. When individuals cannot afford medication, lack access to preventative care, or live in unsafe or unsanitary conditions, local health departments become the first and often only line of defense. Despite this expanding responsibility, New Jersey's local health departments have operated for more than a decade without stable, recurrent state funding. The elimination of public health priority funding in 2011 removed the only dedicated funding stream supporting local public health infrastructure. Since then, departments have relied on patchwork of short-term grants, emergency funds, and local property tax support, none of which provide the stability necessary to sustain workforce capacity, prevention, and programs and emergency preparedness. The consequences are clear. Understaffed departments, reduced services, delayed response times, and a workforce that is experiencing significant burnout and attrition. Health departments are routinely forced to make impossible choices between inspections, education, disease response, and environmental protection, choices that ultimately place communities at greater risk. Designating CEF revenues for public health would directly support prevention and community resilience. These preventative actions save lives and reduce long-term healthcare costs and lessen the burden on emergency systems. Allocating CEF funding to public health is not a diversion from social equity, it is a fulfillment of it. Communities disproportionately impacted by historical inequities are often the same communities served by under-resourced health departments. Investing CEF revenues in local public health ensures the legalization and related revenues are reinvested directly into health, safety, and stability of those communities. I appreciate you hearing me today and would hopefully you take this consideration to support the critical public health structure.
Thank you. Moving on to Cheryl Murray Powell. Cheryl Murray Powell, if you're here, press star 9 or raise your hand. Okay, moving on to Erica Finley. Erica Finley. Harry Stubblefield. Harry Stubblefield. Ernest Tony. If you're here, raise your hand or press star 9 to raise your hand. Ernest Tony. Okay. You can press star 6 to unmute. You should be able to speak now, Ernest.
Hello, can you hear me?
Yes.
Oh, hi, thank you, and good afternoon. Thanks for the opportunity to speak today. My name is Ernest Tony. I'm the founder of BIPOC Can, and I am based in Denver, Colorado. Even though I'm not a resident of New Jersey, I'm speaking today as an advocate and for someone who has family and friends who have been impacted by cannabis prohibition within the state. Today, I'm recommending that New Jersey prioritize the use of its social equity excise fees in 3 specific areas: technical assistance, direct grants, and structured mentorship, all with a focus on business sustainability and regulatory compliance. First off, with technical assistance, from my experience and work over the years, I recognize that many social equity licensees are not failing because of lack of effort or vision. It's because cannabis is one of the most complex, highly regulated industries in the country. And oftentimes the operators are falling short based off of compliance requirements, local approval, tax obligation, and the operational rules tend to be overwhelming, especially for first-time entrepreneurs and founders. I believe that the excise fee should support free or low-cost access to, service providers like accountants and attorneys and individuals who can help those businesses navigate New Jersey's cannabis regulations. This is something that can really help with long-term sustainability and helping these businesses navigate growth and generate revenue, and so that they can be in a position to continue contributing to the economy. Second, grants, not just loans. Access to capital tends to be the biggest barrier that social equity licensees are facing. And because cannabis is still a controlled substance, Schedule 1, it's really difficult for these operators to access capital. So if the state can make available non-dilutive grants to support things like build-out costs and licensing fees, even hiring, that's a direct way to help these businesses generate revenue, create jobs, and also give back. And finally, structured mentorship. One of the things that I've seen be very, very successful is creating opportunities for license holders to work together, build group, build community, and also figure out how they can work with individuals who can guide them through all of the growth challenges that they have. So thank you for your time today.
Thank you. I will go back through the list again for some folks that may not have had the opportunity to speak. Rick Robinson. Rick Robinson, if you are here, please raise your hand or press *9. Moving on to Walter Burton. Walter Burton. Misty Schworn. If you're here, please press *9 to raise your hand. Okay, moving on to Ihab Abu Hassan. Ihab Abu Hassan. Robin Whitfield. Robin Whitfield. Brendan Robinson. Brendan Robinson. Mackenzie Stratton. Mackenzie Stratton. Linda Bush. Linda Bush. Erin Gore. Erica Finley. Erica Finley. Harry Stubblefield. Harry Stubblefield. Commissioner Mapp, that is the remainder of the list.
Okay, thank you very much. Thank you for all those who participated today. Thank you to the CRC team. As a reminder, our next hearing is scheduled for Wednesday, January 21st at 1:30 p.m. Please feel free to spread the word so that we have even more input from our community. Again, I want to thank everyone for being here today. Thanks again. Take care all. Have a great evening.